Hi, I'm Dr. Jorge from Companion Health in Charlotte, North Carolina. And today I wanted to talk about semaglutide, which a lot of people have been asking us about, and I think everybody who's on Instagram or Facebook or TikTok has heard about semaglutide in different forms. So semaglutide is under name brands Ozempic and Wegovy, and those are injections that are actually used. Ozempic is in a pen and it's indicated for diabetes, and Wegovy is a pen as well and it's indicated for weight loss. They're the same medicine, they're just approved by the FDA for two very different things. And so Wegovy is FDA approved for weight loss and Ozempic is FDA approved for diabetes. So that's one of the differences sometimes with these medications. Originally, these medications, which are known as glucagon-like peptides, were designed and discovered for diabetes. The very first one that came out several years ago was something called Byetta or exenatide, also an injection, and at that time that injection was a daily injection. And there's been different ones throughout the last few years that have come out. Liraglutide, which is Saxenda, which was indicated for weight loss. And so these medicines are real effective for diabetics because it helps to control their insulin pathways so that they produce a little bit more insulin when they're exposed to sugar or carbohydrate loads. And it also helps in the pancreas to produce some increased beta cells, which are the things that help produce insulin. How it works for weight loss was, they saw in these clinical trials when they used it in diabetics that weight loss was a side effect of these things. And so there were dedicated trials that were done using these medications specifically for weight loss. And they found in several studies that the molecules, especially semaglutide, was really effective for weight loss. In a trial that was done and published in the New England Journal of Medicine last year, about 60 weeks use of this medicine, they saw about a 14.9% weight loss in the folks that used semaglutide. So real effective for weight loss. So how does it work for weight loss? So apart from the sugar benefits that it has, so controlling sugar pathways and controlling how high your insulin is able to be produced, it also seems to work these peptides in the brain. So it helps to control centers for satiety, or that sensation of feeling full. But it also seems to slow down what's known as gastric emptying. So you tend to move your stomach and your intestines maybe a little slower, and that gives a sensation of being full. So people tend to have a double benefit of their brain is telling them they're less hungry, and their intestinal system is sort of giving that signal of you're less hungry. So there's really kind of a dual benefit that's happening there. Now, none of these medicines should be used in total isolation of the other real important things, which are your nutrition, exercise, getting enough sleep, and managing your stress, because all those other variables also influence your weight. So a lot of folks have been going and getting semaglutide prescriptions either as Ozempic or now Wegovy, and there are different providers that can do this for you. Certainly family practice physicians or physician associates or nurse practitioners. There are specific weight loss clinics that use this. And certainly at Companion Health, we use Wegovy as a tool for weight loss, which we build into a real comprehensive plan for nutrition, exercise, stress management, and sleep to get people to the weight and the optimal health that they want to be at. Thank you.